Hi, Alemayehu. It's wonderful to be talking with you today. Many of our supporters have been fortunate enough to travel to Ethiopia with us and to meet you in person. But for those who don't know you, can you please take a moment to introduce yourself?
Thank you, Claire. I'm Alemayehu Sisay, an ophthalmologist and a public health expert. I'm currently the country director for Orbis International Ethiopia, and I have been with Orbis for the last now 18 years.
The whole world has been impacted by COVID-19. Alemayehu, can you take a moment to tell us about the impact and the restrictions in Ethiopia?
As you know, the government has put a strict state of emergency in place for the first 6 months since March, and that has limited a lot of program implementation, travels, and so on. That is in an attempt to reduce transmission and control the pandemic.
And has Ethiopia started the vaccination program yet?
So the vaccine program, it has a limited number of doses for the entire population. So you can see that only 1.5 million people have been vaccinated so far, but the government is expanding its program to zonal level, district level, and in some areas to Kabbales as well.
Alemayehu, in relation to Orbis's work then, obviously restrictions were implemented last year in March of 2020 that would have halted Orbis's work. What has the impact of that been, and also the impact of that on those people who were at risk of immediate blindness at the time?
I think that's a very important question. Whatever we do, our existence is to help these communities to save sight. And when the state of emergency was declared by the government back in March, that significantly limits our service provision, particularly in the rural community. And the reason I am saying this is because most of our work have been delivered through outreach programs, outreach cataract program, outreach trichiasis surgical program. We go to schools for screening, mass screening of students for refractive error. That has been significantly affected. But we didn't sit quietly. We work with the ministry in terms of developing guidelines, protocols. How can we reach those communities despite the COVID pandemic? Can we put a protocol that ensure safety for our staff, for partners, and for the community as well? So we developed a guideline for trainings, for outreach purposes, and for trichiasis surgical service providers. And if we strictly adhere to those protocols, the chance of being infected with COVID is very low. One thing I would like to emphasize is that the mass drug administration that we are introducing on annual basis for endemic districts, interruption of one round will have a significant consequence. We are treating millions through MDA, millions. And if we interrupt one round of MDA, the implication is profound. We ensured that all the MDA schedule in 2020 has been done successfully without a single incident. And above all, we provided the PPEs required for that, for Orbis employee, for partners, and for communities as well, receiving the treatment. That's significant. So I'm so happy that despite the challenging situation, we have developed protocols for TT surgery, for MDA, for outreach, for cataract.
Thanks, Alemayehu. That sounds absolutely fantastic. Okay, so if you hadn't adapted in the way that you have explained, Alemayehu, what would the implications be for the people in the rural communities?
That would be devastating, Claire, I would say, because trachoma is an infectious process. So we have to interrupt that infectious process timely. So by not conducting MDA timely, we are enhancing the cycle of infection and reinfection within communities and with its own consequence. That means it will take a protracted time to eliminate trachoma, and in the process, people may get blind from it. So that's why we have to strictly adhere to the WHO recommendation and guidelines. And also, that's why we developed the COVID protocols and guidelines, adhering to the WHO principles and so on. Yeah.
Alemayehu, can you just explain to us the implications for a child that goes blind in Ethiopia, particularly in the rural communities?
Thank you, Claire. That's a tough question and also a strategic question. So far, what we have been doing in rural communities, preventing blindness, both in children and in adults. So for a kid being blind, the chance of getting the proper education is very low. The life expectancy will be reduced because as a kid, we want to explore our environment. These blind kids, they don't move. They are immobile. So that will have a life expectancy consequence. Most of the blind kids will die early for a lot of reasons. In terms of providing education, I think the government has selected school for the blind, but considering the big need, that's not adequate. But I would emphasize that our mission and vision focus on treating and preventing avoidable blindness. By doing so, we significantly lower the blindness pool of both adults and children.
Okay, and in relation to trachoma and COVID-19, the messaging around both is quite similar. Can you explain how you worked with local government agencies to spread the message of safety and sanitation?
COVID, by its nature, is transmission through contacts, exactly the same way trachoma did. Contacts. The contact may be families, friends, workplace, and so on, fomites. The good thing about us as development partners, we are working at community level. So all the health extension workers in the rural communities have been trained on eye care. And on top of that, the government has provided a lot of information about COVID. These are the frontline health workers. And a significant majority of the community has got contact with these health extension workers. When you say about COVID, people will, they just become anxious. And we have to capitalize on that when we inform about the importance of hand washing. So in the rural community where we use, local FM radios, we leverage the messaging and say, if you properly wash your hand and face and environmental sanitation, you'll be prevented from both trachoma and COVID.
Okay, Alemayehu, thank you so much for speaking to us today, because I know you're incredibly busy and obviously you have a huge amount of work to continue with there. So I just want to say a huge thank you for having a conversation with us today, and take care and best of luck.
So much, Claire, and it's a pleasure for me to provide you all the information we have in Ethiopia, and I hope the situation both in Ireland and Ethiopia will be improved in the coming months and years, and we can start our regular face-to-face meeting, field visit experience, and so on. So thank you so much. It's a pleasure.
We look forward to being able to go to Ethiopia again to see you too, hopefully.
Yeah.
Thanks so much.
Thank you. Thank you.